I am Leecel Elipane from NUST College of Nursing. Today, I will present on taking vital sign of a patient temperature, pulse rate, respiration rate, and blood pressure. But first, what is vital signs, temperature, pulse rate, respiration rate, and blood pressure? So, vital signs reflects essential body function, including the heartbeat, breathing rate, temperature, and blood pressure. Your healthcare provider may watch, measure, or monitor your vital signs to check your level of physical functioning. The normal vital signs changes with age, sex, weight, exercise capability, and overall health. In taking the patient's temperature, the temperature is very important because it reflects the balance between the heat production and the heat loss of the body. And there are few sites which we could obtain its measurement. From it could be oral, temporal, rectal, axillary, or through tympanic membrane. The pulse is the wave of blood created by the contraction of the left ventricle of the heart. In order for me to measure, I'm going to do palpation on both sides of the patient, which can be through her temporal, carotid, apical, brachial, radial, femoral, popliteal, posterior tibia, and dorsalis pedis. Respiration rate is simply the number of breathing of a person. It takes a minute, and it's usually done when a person is at rest, and just by simply counting the number of the rising of the chest of a patient. The blood pressure is a force of circulating blood on the cell walls of the arteries. Blood pressure is taken using two measurements, systolic and diastolic. Systolic measured when the heart beats and when the blood pressure is at its highest, and diastolic measured between heartbeats when the blood pressure is at lowest. Blood pressure is done to assess the signs and symptoms of hypertension and hypotension, and also the factors affecting the blood pressure. Let us now begin on taking vital signs of a patient. Good day, sir. I am Leecel Elipane from NUST College of Nursing, and I will be your student nurse for today. May I ask your name?
My name is J.M. Elipane.
Age?
I'm 21 years old.
And birthday, sir?
And I was born on August 2, 2000.
Okay, sir. How do you want me to address you?
Mr. Elipane will.
Okay, Mr. Elipane. So, today I will be assessing your body temperature in different areas to identify if your temperature is within normal or if not, so that we can give you immediate care. Also, I will be assessing your pulse rate. It is a measurement of heart rate or the number of times the heart beats per minute. Is that okay with you?
Yes.
Okay, sir. So, before I proceed, I will assemble and clean all the equipments needed and do hand hygiene. Before using the thermometer, clean it with alcohol swab and wipe it from the tip to the body. You can now place it to the appropriate site and do hand hygiene. Okay, sir. So first, I will check your temperature using thermometer. May I ask you, sir, to place the thermometer in your axilla? Sir, I will now select a pulse point and rest your body. For the temperature, wait the appropriate amount of time. The electronic and tympanic thermometer will indicate that the reading is complete through the light or tone and read the temperature. And for the pulse rate, palpate and count the pulse. Place 2 or 3 middle fingertips lightly and squarely over the pulse point. The index finger should be kept proximal to the heart, and the ring finger should be distal from heart. Proximal finger will check the force of pulse. Distal finger obliterate the backflow coming from the ulnar artery. Light pressure is given by the ring finger to obliterate. Count for a full minute, assess the pulse rhythm and volume. After using the thermometer, wipe it again with alcohol swab from the body to the tip and disregard the cotton. And do hand hygiene. For the documentation of temperature and pulse rate, document the temperature and the pulse rate in the vital signs record sheet. Report abdominal result to the primary care provider. Document the procedure in the client's record. Elipane, now that I'm done taking your temperature and pulse rate, I will now observe your respiration rate. Is that okay with you?
Yes.
Okay, the respiration rate is the number of breaths of a person takes per minute. The rate is usually measured when a person is at rest and simply involves counting of breaths of a person for 1 minute. So before I proceed, may I ask if you're comfortable in your position? Okay, sir. May I ask again to put your hands across your chest like this? Thank you, sir. For the respiration, observe and palpate and count the respiratory rate. If you anticipate the client's awareness of respiratory assessment, place a hand against chest to feel the chest movements with breathing. Count the respiratory rate for 60 seconds. An inhalation and an exhalation count as one respiration. Observe the depth, rhythm, and character of respiration. Okay, sir, you may now place your hand at rest. And for the documentation, document the respiration rate of the patient in vital signs record sheet. Report abdominal result to the primary care provider. Document the pulse rate, rhythm, and volume, and your action in the client's record. Okay, Mr. Elipane, now that I'm done taking your temperature, pulse rate, and respiration rate, I will now assessing your blood pressure. So it will serve as your baseline data and it will help you to identify underlying health conditions that may need immediate care. Is that okay with you?
Yes.
Okay, sir. So before I proceed, I will do hand hygiene. So, okay, Mr. Elipane, we will start on measuring your systolic pressure. And may I ask if you can expose your upper arm? If the adult patient is in sitting position, both feet should be flat on the floor. The elbow should be slightly flexed with the palm of the hand, facing up, and the forearm supported at the heart level. Expose the upper arm. Wrap the deflated cuff evenly around the arm. Locate the brachial artery. Apply the center of the bladder directly over the artery. And for adult, place the lower border of the cuff approximately 2.5 cm or 1 inch above the antecubital space. If this is the client's initial examination, perform a preliminary palpatory determination of systolic pressure. Palpate the brachial artery with the fingertips. Close the valve into the pump by turning the knob clockwise. Pump the cuff until you no longer feel the brachial pulse. At that pressure, the blood cannot flow through the artery. Note that the pressure of sphygmomanometer at which pulse is no longer felt. Release the pressure completely in the cuff and wait in 1 to 2 minutes before making further measurement. Okay, Mr. Elipane, your systolic pressure is 130. Now, start taking your blood pressure. Position the stethoscope appropriately. Place the bell side of the amplifier of the stethoscope over the brachial pulse. Hold the diaphragm with the thumb and index finger. Auscultate the client's blood pressure. Pump the cuff until the sphygmomanometer reads 30 mm of mercury above the point where the brachial pulse disappeared. Release the valve on the cuff carefully so that the pressure decreases at the rate of 2 to 3 mm of mercury per second. As the pressure falls, identify the manometer reading. Deflate the cuff rapidly and completely. When the device has determined the blood pressure reading, note the digital result. Okay, Mr. Elipane, your blood pressure is 120/80. Remove the cuff. And wipe the cuff with an approved disinfectant. Now, I am done taking your vital sign. Thank you and have a great day. And for the documentation, document the blood pressure in vital signs record sheet. Report abdominal result to the primary care provider and document the procedure in the client's record.